system. They know that suffering is going to happen. I had one colleague that said, well, I can't afford to go without a paycheck in reference to my Shutdown Act bill, which would actually dock their pay. I can't go without money, but they have no problem having millions of government employees go without their paycheck. This place does something to you that's not right. And look, we got to do the right thing one way or the other. However we get to that result, I'm in for that. But I'm not going to put up with people suffering.
Is your argument that obviously there's been no momentum on reopening the government right now. You are signing onto this bill, so presumably you'd vote for it if it came up for a vote. You want to see Leader Thune put this bill on the floor so at least SNAP benefits and people who get them don't have to go without them while Republicans and Democrats are fighting in D.C.
Look, I voted for Ron Johnson's bill to prevent shutdowns from happening in the first place. I think he's right.
But on the SNAP bill specifically, you want that brought for a vote, right?
Let's bring all these things up for a vote. Ultimately, when you add them all up, it's basically the same thing as a continuing resolution. Look, the Democrats have lost their minds. Again, Caitlin, I never thought I would say that we have elected leaders in America that care more about criminal aliens than they care about American citizens. But that's the reality of the Democrat Party of today.
Well, they're arguing that they want to extend the Obamacare subsidies. Obviously, you know that. And that's been what they have argued is their leverage. And we've seen Republicans say that before, including J.D. Vance when he was in your position, when he was a senator and not the vice president. But on this front, one thing that has been a sticking point here is the filibuster. You have said recently that Republicans should get rid of it so then just Republicans can vote and the government would be reopened. Do you still feel that way tonight?
Well, again, I don't know that the votes exist for that. My point of view is if we can lower the threshold to 55, the government will reopen. And maybe we need to look at that and have that considered because we can't let this keep going on. The Democrats have obviously no problem watching families go hungry. They have no problem watching our military not get paid. The other day, Jeff Merkley sat and kept the clerks and the Capitol Police 24 hours while he read poetry, knowing that they weren't getting paid. Who does that? I mean, where's the humanity in that?
But on the filibuster tonight, would you say, yeah, let's get rid of it?
I personally, if I were in charge of the entire everybody's mind in the Senate, I think if we kept it to a 55 number where we're funding the government, where we're not raising taxes or not increasing spending, I think that's something that we should consider. Again, shouldn't have to happen because we're giving them a clean continuing resolution.
Okay.
Their budget.
But you're saying, all right, so you're saying let's consider it. You're not saying let's do it. As you know, Leader Thune is in charge and he seems to disagree with you. And I know that that was something that was a big topic at your lunch today. The other part of this, though, is what is going to happen with these subsidies? Because the thing that Republicans have argued is if Democrats would reopen the government, then you can have the conversation about what to do on that. And Marjorie Taylor Greene is saying that Republicans don't have a plan on how to bring down health care costs. If the government reopened tomorrow, do you think Republican leaders have a plan on that? Yeah,
absolutely. And I would say to Marjorie Taylor Greene, I like her. She came out to Ohio a few times. She's certainly able to write a bill herself. Like if this is something she's passionate about, put pen to paper, write a bill, present an option. Don't just criticize what other people are doing. In terms of what Republicans think is that the marketplace should work. What Obamacare has proven is that it's a total abject failure at keeping costs affordable, ironically, in the name. So what the Democrats want to do is just throw more taxpayer money. They want to have more giveaways to insurance companies. They want to cover criminal aliens, which is totally insane. What we need to do is lower the cost of health care. That's not a 24-hour question. We need to reopen the government. Let's have an actual adult conversation about what we get together and say, let's give the American people what they want, affordable health care. The Democrats failed in that mission. Republicans did not vote for Obamacare. They did not vote for these Biden-era COVID subsidies.
Okay, but Senator, you're saying that Republicans do have a plan.
Absolutely.
What is that plan?
Well, I mean, we have to have
can people see it?
Sure, we have to have PBM reform. We have to look at the ways that we have a lot of waste, fraud, and abuse in the healthcare system. We have to let the marketplace work. There's no transparency or competition. You look at some things like, for example, the Oklahoma City Surgery Center and what they're doing. That's really innovation in healthcare, more remote, having nurses be able to treat patients in a different way. The whole system can be looked at very holistically, but it's going to take 3 or 4 months to really bring a consensus to that plan. In the meantime, what are we going to do? Keep the government closed for 3 or 4 months every time that we have a policy debate? This is nuts.
Okay, so is there a plan ready tomorrow, or you're saying it's going to take 3 to 4 months to coalesce around a plan?
Look, we have different Republicans, for example, Senator Rick Scott, that's brilliant on this topic, that has a lot of amazing ideas. But yeah, of course, we have to build consensus. This is not a one-man show that runs the United States Senate. We have to bring Republicans together. It should be bipartisan. I think the voters expect us to work together on difficult things, but we can't have a gun to our head and have the government close and people suffering, not being able to feed their families because the Democrats think it's good for them politically. And by the way, they set the expiration of these Biden-era subsidies to be December 31st of 25. They made EV subsidies to go through 2032 on luxury electric vehicles, but they chose to have these subsidies end in 2025.
On healthcare, Senator, what is someone who has open enrollment starting November 1st supposed to do in response to the idea that it would take 3 to 4 months to coalesce around a plan?
Look,